In this lecture, we will be discussing Chapter 6, Death Rates. The death rate is the proportion of inpatient discharges that end in death, and it's usually expressed as a percentage. The hospital death rate is defined as the number of inpatient deaths for a given period of time divided by the total number of live discharges and deaths for the same period. Another name you may hear death rate or hospital death rate referred to as is gross death rate. And always remember, if we include the deaths in the top number of our formula, we need to also include it in the bottom number. Death rates have always been important information for health agencies and hospitals in evaluating the quality of medical care. Death rate information is used by a variety of industries in addition to the healthcare system. For example, the auto industry uses death rate information to determine the likelihood of drivers and passengers dying in certain car models compared to others. Handgun advocates look at death rates to determine the likelihood of someone dying a violent death while using a firearm. Researchers use death rates to show cause of death in certain specific populations. When we're computing hospital death rates, the concept of number of occurrences versus number of times something could have occurred applies. So that means every patient that's discharged from the hospital could have died, or there was a chance of them dying. Of course, that doesn't always happen, but it is still a statistical possibility. So therefore, the formula for calculating hospital death rate or gross death rate is the number of patient deaths divided by the number of patient discharges, including deaths. Death is a type of discharge, or what we could call disposition. Any data representing total discharges include deaths for that period. Thus, deaths are always assumed to be included in total discharges in the denominator unless that formula states otherwise. If deaths of newborn inpatients are included in the numerator, all discharges of newborns has to be then included in the denominator. Patients who are DOA are not included in the gross death rate because DOAs are not admitted to the hospital as they were dead on arrival. Patients who die in the ER are not included in the death rate, again, because they were not actually admitted to the hospital. Patients who die in the hospital while outpatients are also not included. So if you just think, they have to be formally admitted to the facility. If they are in X-ray and they were in the ER, they were not actually an inpatient, so they're not therefore included. Fetal deaths are also not included in a hospital death rate, but they are calculated separately. Because death rates are ordinarily small, the calculation is usually carried to 3 decimal places and rounded to 2. It's a good idea to put a 0 in front of your decimal point, as the example on the slide shows you, to show someone looking at that the rate is less than 1%. Various reporting and accreditation agencies sometimes request a net death rate, also referred to as the institutional death rate. When calculating the net death rate, newborn deaths are included in inpatient deaths along with adults and children. Historically, inpatient deaths were classified either as those that occurred less than 48 hours after admission and those that occurred 48 hours or more after admission. The net death rate came into use because it was felt that healthcare providers should not be accountable for a death that occurred less than 48 hours after admission, because really they wouldn't have had enough time to directly affect the patient's condition. Only emergency treatment could have been provided in that length of time. So regardless of that consideration, the net death rate excludes deaths under 48 hours and is less than the gross death rate. So the formula for net death rate is total number of inpatient deaths, and remember we include our newborn, minus deaths that are under the 48 hour for whatever period we're looking at, whether that be a month, a year, times 100. That's how we get this formula into a percent. And we divide that by the total number of discharges, including our deaths, and then we minus that same number of those deaths under 48 hours. So what we're taking off the top should be the same number we're taking off the bottom. The post-op death rate is also called the surgical death rate, and it refers to the number of deaths occurring after an operation has been performed. Standard instructions for computing the post-op death rate involve the ratio of deaths within 10 days after surgery to the total number of patients operated on during that specific period. A surgical operation is defined as one or more surgical procedures performed at one time for one patient via a common approach or for a common purpose. A surgical procedure is any single separate process upon or within the body that can be complete in itself. It's normally performed by a physician, dentist, or other licensed practitioner, can be performed with or without instruments, and is performed to restore deficient parts, maybe remove disease or injury, extract a foreign body, assist in a delivery, or to aid in a diagnosis. The formula for calculating post-op death rate is the total number of deaths within 10 days times 100, and we divide that by the total number of patients who were operated on for that period. It's important to note we would not want to include all patients in the hospital or all patients who were discharged, because those could not have a death from a surgery because they didn't all have a surgery done. So we would only want to include the patients who were actually operated on. The traditional definition of anesthesia death rate is the ratio of deaths caused by anesthesia during a specific period to the number of anesthetics administered. Because anesthesia deaths occur infrequently, some hospitals might choose to evaluate the relationship between a death and a specific anesthetic for a specific study. There are three main types of anesthesia used. General, that's when the entire body or the entire person is put to sleep for more major surgeries. Regional removes the ability to feel pain or sensation in a specific part of the body, such as an epidural during childbirth. Local is just when an area of the body that has been numbed. The formula for calculating anesthesia death rate is total number of deaths caused by anesthetics times 100 divided by the total number of anesthetics administered. A maternal death is defined as the death of any woman from any cause related to or aggravated by pregnancy or its management. This is regardless of the duration of pregnancy, but not from accidental or incidental causes. An example of an accidental death would be a motor vehicle accident. An example of an incidental death would be something like suicide or homicide. So it has to actually be related to the pregnancy. Many facilities do differentiate between OB deaths and indirect OB deaths. A direct OB death is a death directly related to the pregnancy. So for example, a patient who died after a C-section because of a nick to the uterine artery that resulted in a hemorrhage. An indirect OB death is not directly due to OB causes, even though the psychologic effects of pregnancy are partially responsible for the death. For example, indirect death is diabetes. A pregnant woman can have complications of the diabetes that are aggravated by pregnancy, but the cause of death is diabetes, not pregnancy. When computing maternal death rate, hospitals usually classify only direct OB deaths as maternal deaths and include only those deaths that occur during hospitalization. Non-maternal deaths, those deaths resulting from accidents or incidental causes, are not included. A woman who dies after an abortion is considered a maternal death, as in OB patient who dies in the prepartum period, and that is the period that occurs before childbirth. Some facilities refer to these as antepartum deaths. The formula for calculating maternal death rate is number of direct maternal deaths for that period times 100 divided by the number of OB discharges for the period, including deaths. The maternal death rate includes prepartum not delivered and postpartum. Again, prepartum is the period occurring prior to childbirth. Postpartum is the period occurring after childbirth. Researchers frequently use vital statistic information for public health and policy studies. Researchers use a number of other than 100 in the numerator because they're not really interested in determining percentages, but rather the number of times something actually occurs in a population. For example, researchers may use 100,000 to determine how often something occurred per 100,000 people, or 10,000 to determine how often it occurred per 10,000 people, and so on. The following vital statistics formula for maternal mortality rate may be used in the United States. The formula is number of deaths that are attributed to maternal conditions during a period times 100,000 divided by the number of births during that same period. Another statistic that is used in the description of maternal deaths is one by the World Health Organization. The World Health Organization describes a maternal death as the death of a woman while pregnant or within 42 days of terminating a pregnancy for any cause related to or aggravated by that pregnancy. The formula used by the World Health Organization is the number of maternal deaths times 100,000 divided by the number of live births. Here are some definitions that apply to newborn death rates. Newborn death refers to the death of a live-born infant born in the hospital who later dies during that same admission. Neonatal death refers to the death of a live-born infant within the neonatal period of 27 days, 23 hours, and 59 minutes from the moment of birth. Post-neonatal death refers to the death of a live-born infant from 28 days of birth to the end of the first year of life. Infant death refers to the death of a live-born infant at any time from the moment of birth to the end of the first year of life. Perinatal death is an all-inclusive term referring to both stillborn infants and neonatal deaths. Newborn mortality rate is also called newborn death rate. The formula is total number of newborn deaths for a period times 100 divided by the total number of newborn discharges, including deaths, for that same period of time. Researchers frequently use birth certificate data for public health and policy studies. Vital statistical formulas are used in the U.S., and we'll discuss some examples of those vital statistical formulas. The neonatal mortality rate formula used in the U.S. is number of neonatal deaths during a period times 1,000 divided by number of live births during a period. An infant mortality rate formula is the number of infant deaths, neonatal and postneonatal, during a period times 1,000. Divide that by the number of live births during that same period. A hospital fetal death is defined as a death prior to complete expulsion or extraction from the mom in a hospital of a product of human conception, so fetus and placenta, regardless of the duration of that pregnancy. The death is indicated by the fact that after expulsion or extraction, the fetus does not breathe or show any signs of life. Typically, hospitals are required to report fetal deaths to the state agency. However, reporting method varies according to state laws, statutes, and regulations. Because fetal deaths are not considered patient deaths, they are not included in any other calculation of death, but instead are calculated separately. Determination of whether to include fetal death data in a specific hospital statistics requires an investigation of the facility's needs by administration, medical staff, and reporting agencies. Fetal deaths may be classified as early death, which is fewer than 20 weeks of gestation and a weight of 500 grams or less. Intermediate is from 20 weeks but less than 28, and a weight from 501 up to 1,000 grams. A late fetal death is from 28 weeks completed gestation and a weight of 1,001 gram or more. Both intermediate and late fetal death constitute what is commonly called a stillbirth. The formula for calculating fetal death rate is total number of intermediate and late fetal deaths for a period times 100 divided by total number of live births plus those deaths for the period that we included in our top number. A mortality rate measures the risk of death for the cause under study in a defined population during a given period of time. The formula, an example, number of cancer deaths during a period times 100,000 divided by the total number in the population that is at risk. Knowledge of health stats is an essential tool for cancer registrars. A cancer registrar is an individual who is responsible for maintaining records and reporting information about cancer patients. Hospital cancer registries were developed as an organized program in hospitals that collect information about cancer patients. Cancer registries' primary goal is to help improve treatment of cancer. The information collected can be used to compare different types of therapies that are used to treat cancer. Hospital and other cancer registry data are reported to population-based registries. When you're calculating the cancer death rate in your own facility, use the formula for a rate. That is the number of deaths from a specific diagnosis of cancer divided by the number of discharges of that same diagnosis of cancer.